Covering your health this evening, as we first brought you breaking news last night, the first human death from bird flu has happened here in South Louisiana. The elderly patient, who did have contact with both domestic and wild birds, also had underlying health concerns.
As News 15's Brian Yennis explains, despite how contagious bird flu actually is, health officials today are saying the risk of contracting the disease is low for most of us.
The first bird flu death in the U.S. has been confirmed, but health officials still are not worried about the risk to the general public.
It's not circulating in humans, but it is jumping into humans who are exposed, particularly those exposed to poultry or to the dairy cattle.
The patient who died Monday lived in Louisiana, was over 65, and reportedly had underlying health conditions. The patient was also exposed to both backyard chickens and wild birds, the main carriers of the disease.
Where we're seeing most of the movement from animal to human, but we're not seeing sustained circulation.
Farm workers in close contact with poultry and cattle are the group at the most risk. Still, bird flu mortality remains very low, and patients most susceptible are those with vulnerable immune systems.
It is not a new virus. It was first identified in 2001. It's been in the human population for a long time. It is a common virus that circulates in winter and spring. It usually causes respiratory symptoms similar to the common cold.
But one way people can protect themselves is by getting a flu shot and
not drinking raw milk or unpasteurized milk products, because the risk is just increasing in dairy cattle in California.
Over the past year, the CDC has confirmed more than 65 cases of bird flu nationwide. 37 of them have been reported in California. Brian Yennis for News 15.